So when it comes to breast cancer, early detection is key. Dr. Ruby Meierotto from St. Luke's is here to tell us all about the hospital's unique program. So what does that care look like?
All right, well, St. Luke's Health System, we have a high-risk breast clinic, and it's run by specialized nurse practitioners. So this clinic allows high-risk women to be monitored very closely, usually every 6 months, with a thorough clinical breast exam and often imaging, so such as a 3D mammogram, breast ultrasound, and breast MRI. This imaging is then interpreted by a fellowship-trained breast radiologist like myself, and then depending upon the patient's personal and family history, she may also need a referral to the ovarian cancer screening, a genetic counselor, medical oncologist, and or a breast surgeon.
And you're talking about really services that are geared for people who are at a higher risk. So what are some of those contributing factors?
So the American Cancer Society website does a great job listing all of the risk factors that can increase a patient's chances of developing breast cancer, but some of them include having a family history for breast and or ovarian cancer, especially a first-degree relative, so mother, sister, or daughter, having certain genetic mutations, the BRCA or BRCA genetic mutation, and then having multiple breast biopsies, especially if one of those biopsies showed something like a high-risk marker, LCIS, for example. Now, if a patient thinks she's at high risk and she wants to learn more about it, she can visit one of our nurse practitioners in the high-risk clinic to learn her true risk. And then, again, depending upon family history, she may still need to see a genetic counselor who will help the patient understand her genetic risk, what the risk means to her children and her family members, and then also learn more about DNA testing.
Okay, and this all circles in for what we need to do. If we do have a higher risk, we want to lower that. So what are some ways we can reduce it?
So 4 tips and suggestions from our nurse practitioners are number 1, know your BMI or body mass index and keep it within that expected range. So just simply maintaining a healthy weight can reduce your chances of getting breast cancer. Number 2, kind of along those same lines, you want to eat a clean, healthy, plant-based diet. They tell their patients foods that are recognizable to a time traveler over 300 years ago. So unfortunately, some of my favorites, those decadent desserts and soda drinks that we love, that's not a part of this diet. Number 3, eliminate processed foods and also eliminate as much plastic exposure as possible, plastic bottles, microwaving in plastic and storing in plastic. Some of those chemicals can unfortunately increase a woman's chance for developing breast cancer. And then number 4, along the same lines, limiting chemical exposure while cleaning, and then pesticides in foods.
Okay, well, all those such great dietary considerations, especially if you need to lower that risk. Now, let's talk about early detection and why it's so important.
So early detection gives our patients the best chance at treatment success. According to the American Cancer Society, 99% of women are alive in 5 years diagnosed with stage 0 and stage 1 disease. Now, you contrast that with only 27% of women alive in 5 years diagnosed with stage 4 disease. So our high-risk breast clinic is designed to educate women to reduce their chances of getting breast cancer, but then if they do, we are determined to catch it as early as possible and, of course, ultimately help save lives.
Well, Dr. Ruby Meierotto, thank you so much for all that. For more information on this unique program, visit stlukeskc.org.